Autoimmunity. We know acquired immunity is based on the memory, correct? And it is more prominent in the higher vertebrate like mammal, correct? And this acquired immunity is based on the differentiating. We can differentiate what is harmful for us, what is useful for us. Self cell means own body cell, outer body foreign cell. But we don't understand on like this basis two corollary of this ability, like how these are correlated. Right? We understand that there is antigen antibody interaction, foreign body or antigen, they help to produce antibody from the immune system. But we still are not able to distinguish properly. Correct? Higher vertebrate can do this properly. They can distinguish what is the foreign body, what is foreign organism. Correct? They can distinguish both. Because foreign organism is different thing. Example, bacteria is foreign organism, but food we are eating is foreign molecule. So our body is not destroying food, but it is destroying bacteria. Correct? So higher vertebrate are able to differentiate what is foreign molecule and what is foreign organism. And this is a very good question. You must have not noticed this. The higher vertebrate can differentiate these two. Okay. And when we talk about the experimental immunology, means immunology, how we apply in the real life, this is really important. Correct? And sometimes because of the genetic factor or some unknown reason, body start attacking self. This result damaging the self body and known as autoimmune disease. So remember, you will never forget autoimmune disease, a disease in which body destroy own self. Okay? That is autoimmune disease. But if question asks, can higher or vertebrate distinguish? Option one will be foreign molecule. Option two foreign organism. Option three both of them. Option four none of them. This can be question. And what is the role of the experimental immunology? Dealing with the foreign molecule, dealing with the foreign organism, dealing with the autoimmune, none of these. Something like they can frame difficult question. So that is the difference between the easy question and difficult question. Easy question are the prominent one. You can easily differentiate. Difficult question is when you understand each and every line perfectly, then no question is difficult question. Example further. Immune system in the body. Question can be asked, what are the component of human immune system? We have lymphoid organ, T lymphocyte, B lymphocyte, thymus, bone marrow. We have tissues, we have cell, we have antibodies. Question can be asked, what are the component of human immune system? They will give these four and two more. And you have to tell how many of these are human immune system component. Tissue, cell, soluble substance, antibodies, lymphoid organ. Correct? What is the benefit of the immune system? Because it can recognize the foreign antigen and respond to that and remember them. Memory. Remember them. So immune system plays really important role in many other activity like in allergic reaction, IgE is crucial. Autoimmune disease where immune system destroying own cell, and organ transplantation where cell mediated immunity is important. T lymphocyte is important. Correct? So in all these things, immune system play important role. Lymphoid organ where origin as well as maturation and proliferation of lymphocyte occur. This definition is important. What is lymphoid organ? Organ where lymphocyte origin, where lymphocyte mature or lymphocyte proliferate, leave. Right? Two primary lymphoid organ is bone marrow and thymus, where immature lymphocyte will become mature, differentiate into the antigen sensitive lymphocyte. So this happen in the primary lymphoid organ, where immature lymphocyte become antigen sensitive. Correct?
So
After
can I back
maturation,
in 2 minutes?
yeah. After maturation, these antigen sensitive lymphocyte will migrate to the secondary lymphoid organ. After maturation, they will migrate to the secondary lymphoid organ. Question asked, name the secondary lymphoid organ. Spleen is one, lymph node is second. tonsil is third, bare patches of small intestine is fourth, appendix is fifth. Very important. What are the example of secondary lymphoid organ? Correct. These secondary lymphoid organ provide the site for the interaction of the lymphocyte with the antigen. Remember, in primary lymphoid organ, immature lymphocyte become mature. In primary lymphoid organ, immature lymphocyte become mature. But in secondary lymphoid organ, your mature lymphocyte interact with the real antigen. Real fight happen in the secondary lymphoid organ, where there is a proper interaction of the cell with the antigen, which then proliferate to become effector cell. When these lymphocytes interact with the antigen, they become effector cell. Effector cell means they destroy the antigen. Correct. Location is important. Thymus in the chest region, below sternum, lymph node all over the body, in the arm region also. Lymphatic vessel is present all over the body, not only here. Correct. Lymph nodes. As you can see, there are so many lymph nodes. Correct. If you see this, these are the lymph node given. There are more in the thigh region and arm region. These are the lymph nodes. See, in neck region we have lymph node. That's why we observe here. Correct. These are the lymph node. Correct. Bone marrow is the main lymphoid organ where all blood cell, including lymphocyte produce. So all blood cell, RBC, WBC platelets produce here. Thymus is the lobed organ. There are lobe units, and it is located near heart and below breastbone. Breastbone means sternum. Breastbone is sternum. Okay. Thymus is quite large at the time of birth, but keep reducing in the size with the age, and at the time of puberty, attain it reduced to a very small size. Okay, so at the time of birth, thymus is biggest. Then it will keep its size will keep on reducing. At the time of by the time of puberty is attained, it reduce to the very small size. Remember, if question asked in what age thymus gland is maximum, answer is by puberty. Like 10, 12 age, the best maximum age of the immune system to fight strongly with any of the organism. In very old age, it is negligible. That's why old age people get disease very easily because thymus gland is weak, T lymphocyte are less. If T lymphocyte are less, it will not help to produce antibody. No antibody means this will get disease easily. Both, whether bone marrow or thymus, will provide proper environment for the development and maturation of T lymphocyte. Correct? Both. Remember, both word is important. Both bone marrow and thymus provide proper environment where T lymphocyte can mature and develop. Next, spleen. Spleen shape is large. Sorry, spleen shape is bean, which is large organ. Correct. Spleen contain
So the
lymphocyte as well as
largest
lymphocyte.
lymphoid organ will be the spleen, right?
Yes, Rayan.
So the largest lymphoid organ, spleen.
Yes, yes. Largest
The main
lymphoid
is the
organ.
bone marrow.
Yes. Then this spleen act as a filter of blood by trapping the blood-borne microbes. So these spleen will filter the blood. In blood, if there is any organism that can cause disease, it can trap those organisms and kill them. Correct. Spleen is also large reservoir of RBC can trap here. After death, RBC will store here. Correct. Lymph node are very small and solid structure. This word is important. Small and solid, and located in different point along the lymphatic system. So lymph node are present in lymphatic system. They are small solid structure. What is the purpose of lymph node? Same. Trap microorganism or antigen. Microorganism or other antigen which happen to get into the lymph or tissue fluid. Because they try to enter into the blood, these lymph node will trap it. Spleen will trap it. Correct? So when antigen trap in the lymph node, what will happen? They will activate lymphocyte. If lymphocyte are present there will be proper immune response, and immune response will kill them. If any organism enter into blood, then when blood pass through the, you know, either spleen or blood pass through the lymph node, what will happen? This lymph node or spleen will trap the antigen. Antigen activate the lymphocyte, and immune system will kill it. Correct? So
So,
lymphoid, yes,
what kind of microorganisms are we talking about here?
bacteria, fungus, virus.
Okay.
For reference, you can take bacteria, all which, but all microbes we are talking about.
Hmm.
There is a lymphoid tissue located within the lining of the major tract, major respiratory tract, because we have mucus there, digestive tract, we have mucus here, urogenital tract, we have mucus there. That's why, because they have mucus, it is MALT, mucus associated lymphoid tissue. And because in these three systems, maximum number of organisms can enter, that's why they form the 50% of the total lymphoid tissue in the human body. These three: respiratory tract, digestive, and urogenital. Why? Because there are opening in all three systems. When there is opening, microbe can enter into this area. To trap these microbes, we should have lymphoid tissue in these three areas, and we have a lot of lymphoid tissue in it. That's why you see, for respiratory tract and the digestive tract, all both are present in common region of the neck. That's why you will see in neck region there are a lot of lymphoid organs. Second, you will see either it is mainly in the near neck region, to make sure that all these organs do not go beyond it and should not enter into the
The lymph
sensitive
nodes
area.
are mainly located in that neck wala portion or in the whole body.
Pelvic region. In pelvic region, neck wala portion is more. Why? Because in pelvic region there is urogenital tract, so microbe can enter there. तमन्ना, क्लास में वीडियो ऑन करना कंपलसरी है, ठीक है? अदरवाइज अगर जो बच्चा वीडियो ऑन नहीं करता है, आई हैव टू पुट देम इन द वेटिंग ग्रुप. ओके, तो ये याद रखना. देवांश एंड जॉर्डन, व्हाट अबाउट योर वीडियो गाइस?
So,
जो
Jordan
गाइस,
said he'll be back in 5 minutes in the chat box.
ओके, रिमेंबर ऑल ऑफ यू. यस, व्हेन यू आर गोइंग, you intimate ki sir, I'll come in this minute, so I'll make sure I don't remove you. Next. So this part is done. AIDS is one of the easiest topic. Why? Let me show you. First definition: acquired immunodeficiency syndrome. It means we have immune system, weak immune system, and we acquired this during our lifetime. So it means it is not by birth. Congenital means not by birth. And
Excuse me.
syndrome, yes, Sarah.
So before you start AIDS, can you do a quick revision of the previous topic?
Yes. Previous topic of lymphocyte, right? Lymphoid. So remember, the role of lymphoid organ is to protect us from the antigen by producing antibody. So there must be some structure that produce antibody or help in the production of antibody. Correct? These structure divided into two parts. Primary lymphoid organ, where actually lymphocyte produce, like bone marrow and thymus. And secondary lymphoid organ where actually these lymphocytes interact with the antigen and kill them by becoming effective, by becoming effective. There are many secondary lymphoid organ like tonsil, Peyer's patches in small intestine, spleen, lymph node. Correct? All these are secondary lymphoid organ where lymphocyte produce antibody and kill antigen. Correct? Spleen is one of the largest bean-shaped structure that trap uh, the organism microbes. Spleen have lymphocyte as well as phagocyte to kill them. Spleen also reserve RBC. Correct. Second, if you see lymph node are small solid structure. These lymph node basically trap the microbe in the blood and kill them. Okay. Majority of the lymphoid tissue, 50% of the lymphoid tissue present in the respiratory system, like entry of respiratory system, digestive system, and urogenital. Why? These three systems have mucus, watery material, and there is an opening. Through our nose, we can enter into the respiratory system. Through mouth, we can enter into the digestive system. So, lot of microbes can enter through this area. Correct? To avoid this, we have lot of lymph node in this area, lymphoid tissue in this area. So, this lymphoid tissue protect us and destroy all the organism entry through these three openings. That is known as MALT, mucus associated lymphoid tissue, which is cover almost 50% of the total tissue. Understood, Sarah?
Sir,
Yes, Pratigya.
हमें थोड़ी देर के लिए ठंडा होकर
ठीक है. Understood, Sarah? Any doubt?
No doubt.
Next. AIDS will be quick. It's 11:03. Before 11:15, I will finish everything from the see. Acquired immunodeficiency syndrome we acquire in the life, not by birth. We have group of symptoms, that's why syndrome. First case was reported in 1981. Important. In last 25 years, we have more like it killed more than almost 2 crore people, 2.5 crore people. Correct? Caused by this virus HIV. HIV is the member of retrovirus, and this virus have envelope and envelope contain RNA genome. So this is RNA virus like tobacco mosaic virus. Correct? This HIV can transmit from one person to another person through the sexual contact with the infected person, or contaminated blood or blood product, or sharing infected needle in case of intravenous drug abuser, or from the infected mother to the child through placenta. Correct? So these people are on the higher risk, especially who have multiple partners. Correct? Drug addict who take intravenous drug, or repeated blood transfusion, maybe one of the blood is infected, or children whose mother is infected. Right? So it's important that this do not touch by the simple physical contact or touch. Correct? Only it spread through the body fluids. That's why physical or psychological well-being, that HIV person should not be isolated from the society because they have HIV, because it is not spreading by touch. Correct? And there may be time gap between the infection and appearance of the symptom. This is the biggest problem with the HIV. Maybe HIV patient had HIV infection or like entry of the HIV virus 5 year back or 10 year back, but now after 5 years they are showing symptoms. Correct? So this period can vary from few months to many years, even 5 to 10 years. That's the problem. If two people are having physical contact and they were not having any symptom now, after 5 years we get to know that one of the partner had HIV. That's the issue. That's why you will see that nowadays whenever we check blood, we make sure that there is no HIV in the blood. We check whenever there is a pregnancy, mother go to the government hospital and there is a proper test for the HIV. Is HIV present in mother? So it should not transfer into the children. So they can make sure the children is not affected. So we government is taking enough measure to make sure ki there is not spread. Correct. Diagram is important. Ki retrovirus is the envelope virus envelope with RNA. Correct. It infects normal cell. When normal cell is infected, RNA will enter into the cell. When RNA enter into the cell, DNA, RNA will produce DNA with the help of reverse transcriptase enzyme. This enzyme will convert RNA into DNA. This DNA will interact with the host genome DNA, correct? And now host DNA will produce new RNA, correct? And multiple RNA will be produced. There was entry of one virus, now it is producing three virus, correct? New virus can infect the other cell. Again, every cell will produce multiple um, virus. Infected cell can survive while viruses are being replicated and released. That's why we said sometimes it takes 5 to 10 years. Why? Even cell is affected, still cell can survive. So that's why you will not see much symptom in the early stage. Correct. Next. Once virus get into the person, virus enter into the macrophage. Cell name is important, macrophage, where RNA genome of the virus will replicate to form DNA with the help of enzyme reverse transcriptase. This viral DNA will enter into the host DNA and directly infect the cell and produce more virus particles. That's why macrophage will continue to produce virus, and that's why macrophage will act like HIV factory. Why? Because macrophages are producing more cells. Correct? Simultaneously, HIV is also entering into the helper T cell. HIV is also entering into helper T cell. When HIV enter into the helper T cell, it replicates and produce more virus. So progeny virus is released into the blood, attack the other helper T cell. So two important cell affected by the HIV is one macrophage, HIV factory, and second is T lymphocyte. Very, very, very correct. And because of this, like T cell is continuously affected, you will see there is a decrease in the number of the T lymphocyte in the body. Correct. And you know T lymphocyte is important for they help in the antibody formation. So immunity will go weak. During this period, person will suffer from the fever, continuous fever, diarrhea, and weight loss. Right. And because there is a continuous decrease in the helper T cell, person will start suffering from the infection. That was very normal. Nobody get infected in the normal stage, but this person will be affected due to the bacteria like Mycobacterium tuberculosis, TB, virus, fungus, even the simple parasite that do not cause disease normally, mm, toxoplasma. So toxoplasma and mycobacterium is important. Virus and fungus word is important. Parasite word is important. So patient become immunodeficient. Short like immune system become weak. So person is unable to protect from the infection. And to diagnose this AIDS, we use enzyme-linked immunosorbent assay ELISA test to identify the AIDS. So treatment when we use antiretrovirus drug is partially effective, not 100% effective. Statement can be given. Ki antiviral drug are 100% effective to treat AIDS. Answer is no. So it can only prolong the life of the patient, but cannot prevent death. Death is inevitable. So if person get HIV, person will die sooner or later. Sooner or later means it depends how they take care of the system. Correct? Prevention. Because it's have no cure, prevention is best option. That's why in the case of HIV, infection, conscious behavior pattern is really, really important. Correct? It's not like pneumonia or typhoid where we can treat the patient and we can cure. No. Because infection occur through the blood transfusion. So poor monitoring could be the one reason. So we have to make sure that whenever mother is like like mother is pregnant, to make sure that there is a proper test for the HIV. Correct? The only excuse is maybe ignorance, and rightly said, don't die of ignorance. Okay? When we know the thing, we should get it done. In our country, we have organization, National AIDS Control Organization, NACO, and another NGO are doing educating people about the HIV. WHO start multiple program to prevent HIV infection. Example, they are making blood safe from the HIV and ensuring only proper needle should be used and proper syringe should be used, even public, private hospital both. Correct? A free distribution of condom to spread through the sexual contact, control drug abuse, so prevent through the needle abuse, IV abuse, safe sex, promoting the safe sex and regular checkup of HIV susceptible population. Right? Especially HIV is very common in Africa, very common. Correct? Infection with HIV or AIDS is something we should not be hidden because this can spread to the more people. Correct? So HIV patient need to help and have sympathy instead of shunned by the society. Oh, this patient have HIV, stay away from this. Because if we do like that, people will not tell about their problem. They will not tell that they are HIV infected. And if they are not telling, it can spread to more people. Correct? Unless society recognize it is a problem to deal with the collective manner, otherwise it will spread many times. So it is a malady that we can only be tackled by the society and medical fraternity acting together and to prevent. Because if society is not helping the medical fraternity and society is not telling, like patient are not telling to the uh, people, ki, yes, I have HIV. So and people respect them in a way, ki, okay, we'll work in a way ki, how we can cure it or how we can prevent it. Have proper sympathy with the patient, we can cure it. So it took us 10 minutes to finish the HIV. Anybody have question from HIV?
No, sir.
So if there is no question, what is the time now?
I think
In
that
11:30. In next 12 minutes, we'll try to finish the one of the popular question, cancer. Uh, one of the most dreaded disease in the human being and major cause of the death all over the globe, not only in India. Like more than millions of Indians are suffering from the cancer. Large number of them die annually. And how this cancer develop, how this normal cell become oncogenic cell, we have to study this. We have to study how to treat, how to control. Correct? To understand this, we should know how cell growth and differentiation occur because it is a highly controlled and regulated process. In case of cancer cell, this normal mechanism will break down. Normal cell show the property of contact inhibition, in which, like when one cell come in contact with the other cell, there will not be unlimited growth, uncontrolled growth. Correct? Cancer cell will lose the property of contact inhibition. Because of that, cancer cell will continuously divide and give rise to a mass of cell. This mass of cell is known as tumor. Cell mass is known as tumor. Tumor are two types. Benign, where it will remain at one location, do not spread to other, and do very minimum damage. Like mole kind of thing. Mole is one kind of benign tumor. Malignant tumor is the mass of the proliferating cell, dividing cell, neoplastic or tumor cell. Neoplastic or tumor cell. This grow rapidly, invade and damage surrounding tissue also. So it will divide actively very quickly and grow and starve the normal cell by competing with the nutrient. Because you have cancer cell, you have normal cell. Cancer cell is dividing fast, so they need more nutrition. So cancer cell will take all our nutrition and normal cell will not get. So there are two type of loss. Cancer mass is growing and normal cell are dying. Right? Cell slump from such tumor will reach to the distant part of by the blood because some cell will break and they will go to the different part of the body with the help of blood and again they lose again they start new tumor. Correct? This property of continuously dividing is metastasis, most feared property of malignant tumor, like continuously spreading to all the parts, to full body. What are the different possible cause for the cancer where normal cell convert into the cancerous neoplastic cell? It can be physical, chemical, or biological. Example: this chemical that cause cancer is known as carcinogen. Example: X-ray and gamma rays. Both are ionizing radiation can cause cancer. Correct? And non-ionizing radiation like UV can damage DNA and can lead to the transformation. Question can be asked: ionizing radiation X and gamma, non-ionizing UV. Very, very, very important. Both all damage DNA cause mutation in DNA and neoplastic transformation means cancer. Chemical carcinogen is present in
So,
tobacco
one
smoke.
question, sir.
Yes, Jordan.
So, what's the difference in ionizing and non-ionizing?
Ionizing means it will break the bond properly and it will form ion within the molecule, within the cell, within the DNA. It will make ion. It means more dangerous because it will react further. Non-ionizing means it is changing the structure but not breaking the bond completely.
Okay, so got it.
Okay. So lung cancer is mainly because of tobacco. So tobacco is the chemical carcinogen. Correct. Cancer causing virus are known as oncogenic virus. Onco means cancer. Genic means forming. Cancer forming virus is oncovirus. This oncovirus have special gene known as the viral oncogene. Gene present in the virus cause cancer is viral oncogene. Multiple gene that we call cellular oncogene or C oncogen or proto oncogen are usually present in the normal cell. They are not causing any damage. But when we provide them the certain condition, normal cell proto oncogene convert into the proper oncogene and they are causing cancer. Correct? How to detect the cancer?
Sir, can
We
you
have
tell the difference between carcinogen and oncogen again?
carcinogen and oncogen are same thing. Carcinogen is the general term. Oncogene are the special gene where normal cell convert into the cancerous cell in special conditions. So oncogene are also carcinogen because they are causing cancer. Anything that is causing cancer is carcinogen. Now there are different versions. Radiation can produce, then it is radiation carcinogen. Chemical can produce chemical carcinogen. Special gene in the cell, biological agent can cause, some virus can cause cancer, then oncogene virus. Understood, Sarah?
Yes, sir.
Next, early detection is important, you know, if we want to treat it properly. Correct? And one of the main thing we have to do for the detection is biopsy. Histopathological study of the tissue or blood or bone marrow. Correct? Because if there is an increase in cell mass of in the bone marrow, it can be case of the leukemia, blood cancer. Leukemia means blood cancer. What happen in biopsy? We take suspected tissue where we expect there can be cancer. We can make thin section, we color them, we examine them under microscope, histopathological study. Pathologist is the scientist who study the proper this tissue and examine them. And biopsy is the gold standard for the cancer. If you want to detect cancer properly, biopsy is the best method. Another method in the radiography is X-ray we can use to detect the big mass. CT scan, computed tomography we can use. MRI, magnetic resonance imaging we can use to detect cancer of internal organ. Cancer of the internal organ. CT scan use X-ray and CT scan make 3D image of the internal uh, object. Like if you take lung or if you take liver, then CT scan will make 3D image of it. CT scan will make 3D image. CT scan will make 3D image. In case of MRI use strong magnetic field and very important for your NEET exam is MRI have non-ionizing radiation. Like MRI do not have harmful radiation. So it also accurately detects the pathological and physiological change in the living tissue. This word Pathological means what is the cause of the disease, it can identify. And physiological change, what is the secretion of the material? Very important physiological one. And I am telling you where you make mistake. Like MRI is non-ionizing radiation. You must have read, but you might miss physiological change. Key MRI can detect pathological change, physiological change, both of them, none of these. There you face issue. So antibodies against the specific cancer can be used for the detection of the certain cancer. Key
Can you repeat what did you say just now about the pathological and physiological changes?
MRI can identify both pathological and physiological changes in the tissue.
So,
Okay.
but how does it identify pathological changes? Isn't that
Pathological change means if organism is causing disease, it can identify because MRI image will come different. If physiological change, example, extra excessive HCl is produced, excessive mucus is produced, then there will be different slide of MRI.
I mean,
Okay.
I thought only MRIs were used to like for imaging, like only physiological changes. Pathological is something which you have to take to the lab.
Now, pathological is the primary thing. Physiology is secondary. Pathology
Okay.
is, of course, we want to identify pathological. What could be the reason?
They'd
Correct.
find the
Where?
cell type and all that, all of that.
Yes.
So that's what I was wondering, how does MRI identify that?
Yeah, because it is not telling us exactly which bacteria, but it will tell ki there is the damage in particular part. So based on that, now we have to like we have to identify, we have to do biopsy. Biopsy is
Yes, sir.
ultimate.
Yes, sir. Yes, sir.
We can use antibody also to detect the cancer. And the technique of the molecular biology can be applied. Molecular biology, PCR, we can apply. Molecular biology means PCR. Molecular biology means PCR. Correct. Uh, with inherited susceptibility to the certain cancer. Certain cancer is inheritable. They can easily happen in some people. Right? If we identify this gene and we identify how these people can get cancer easily, we can avoid them. In the example, if person have susceptible to the milk, and if milk can cause cancer in the long run, at least we will tell patient kid not to have milk in your life. Like this kind of predisposable factor. What is the main factor? Like maybe smoking is very dangerous for one person, so we can avoid. Such individual may be advised to avoid exposure of the particular carcinogen which are susceptible to. Example, tobacco smoke is really dangerous in the lung cancer. Tobacco smoke is really important for the lung cancer. How to treat? There are multiple approaches: surgery, radiation, immunotherapy. In case of radiotherapy, we will throw radiation on the cancer mass, and we make sure ki
I will be back in 5 minutes.
normal tissue are protected. We can use chemotherapy medicine to kill the cancer mass. We can use like there is specific medication for the specific type of tumor. Majority of drugs have side effect like hair loss is very common, blood loss is very common. Most of cancer is treated with using all three. We use surgery, we use radiotherapy, we use chemotherapy. All we use. Correct. So tumor cell have been shown to avoid detection and destruction by the immune system. Sometimes immune system is not able to destroy tumor cell. That's why patients are given the special chemical biological response modifier alpha interferon. These special interferon will activate the immune system. Activate the immune system means it will destroy the. I told you I'll finish this topic by 11:25. Tell me, you understood everything? Should I explain this again?
I got it, sir.
Everybody raise your hand if you understood well. Yes, first date, Devas, Rayan. Okay. Now you have more theory part, but this drug and alcohol abuse is really, really, really important. So If we take survey and see the how drug and alcohol abuse is pattern is there, so it is more among the youth. I don't understand why people smoke. Like logically, it do not make sense for me. Why people consume lot of alcohol? Alcohol on the occasion is okay, not bad, but alcohol every single day doesn't make sense. Right? So this is a real concern. That's why proper education and guidance is really important to the youth so they can avoid this. Right? In case of drug, there are specific drug that is harming us, and most of the drug is obtained from the flowering plant angiosperm. Correct? Some can be obtained from the fungus. Really important question. Okay, most of the uh, drug are obtained from the flowering plant, not for fungus. Wrong. It is obtained from fungus also. Opioid, first category. Opioid are the drugs that will attach to the specific receptor. These receptors are present in CNS, central nervous system, or GIT. CNS and GIT. Example, heroin. Heroin is also known as smack, and heroin is chemically diacetylmorphine. And this heroin is white color, have no taste, no bitter taste, but no odor, no smell, and it is crystalline structure. Heroin is also known as smack. It is diacetylmorphine. It is white, odorless, and bitter taste. How we can obtain heroin? Heroin is obtained from the acetylation of morphine. That's why acetylation. Correct? And this is obtained from the latex of the poppy plant Papaver somniferum. Very, very, very important. Latex of Papaver somniferum. How we take heroin or morphine? By snorting, by injection. Snorting like this, right? Heroin is depressant. It slow down the body activity. Diagram is also important. Here you have poppy plant, latex part you use. And here you have morphine structure. Easiest way is four ring are present. Four ring are present. You can't remember the full diagram. Four ring are present, done. And closed ring, compact closed ring. Cannabinoid are the chemical that interact with the receptor present in the brain. See, in case of opioid, CNS plus GIP. In cannabis, mostly in brain. So when we see the natural cannabinoid, they are obtained from the inflorescence of cannabis sativa. Opioid from poppy plant, Papaver somniferum latex part. It is from the inflorescence part. So that's why flower top, leaves, or resin of the cannabis plant can be used for the various combination. Either leaves, either flower top, either resin to produce what? Marijuana, hashish, charas, ganja, all are cannabinoid produced from the different part. Example, how opioid is taken by the snorting or injection method. It is taken by the inhalation method and oral ingestion. Orally, like we can put in the, like there is a mass we can directly put in the mouth, and they are affecting the cardiovascular system. You know, heroin is depressant, slow down the activity. It will affect the cardiovascular system. In this case, you have long chain, and there is only one ring. Correct? There is only one ring, but one ring and expanded structure. But in case of morphine, four ring and compact structure. Correct? And leaves of the cannabis sativa. They have latex of the poppy plant, leaves of the cannabis sativa. Diagram is really, really important in this case. Last is coca alkaloid or known as cocaine. Coca alkaloid or cocaine is obtained from the coca plant. What is the name of coca plant? Rhizosylum coca. Where this plant is present in South America, like Amazon jungle. What is the role of the cocaine or coca alkaloid? It interferes with the transportation of dopamine. It interferes with the dopamine. So, what is another name of cocaine? Coke or crack. How it is taken? By snorting. Even morphine is taken by snorting method or injection. Inhalation or oral method in case of cannabis, and here snorting again. What is the role of the cocaine or coke or crack? These have a stimulating action on the central nervous system. Stimulating action, we feel good, euphoria, good energy, high energy, good feeling. But when we take excessive dose, it can cause hallucination. You observe something that you, which is not real. Correct? Example, there are some hallucinogenic property present in the Atropa belladonna, very important, and the Datura plant. Here you have the Datura plant. Atropa belladonna and Datura plant have hallucinogenic property. If you get a cocaine from that, then they will like person can become half mental. You can say in the simplest way. These are also abused by the sports person. Correct. If we take medication, barbiturate is used to used in the sleeping pills. Amphetamine, benzodiazepine, all these used in the sleeping pills, and these are normally used in the medicine. Correct. Help to cope up with the mental illness. Like if person in depression, person in insomnia, not able to sleep properly, they take barbiturate, amphetamine, or benzodiazepine. Correct. But problem is they are abused. Same way, morphine. Morphine is sedative and painkiller. Sedative means you can use this in the surgery to reduce pain. Correct. And it is really useful. Morphine is really useful people who undergo surgery because it is depressant. It will reduce, slow down the activity. Person do not feel pain. Correct. Jordan and Chandana, you had same question in your board exam. Use of morphine.
Yes.
I still
Yes, sir.
so many plant, fruit, and seed have hallucinogenic property and used for hundred of year in the folk medicine and in old medicine, religious ceremony, and the ritual. Like bhang is used in the religious ceremony, but I don't think it is logical. Maybe people consume once a day is okay, but not for the long run. So when it is taken other than the medicinal purpose, it is harmful. Or amount and frequency make huge sense. How much amount you are taking? Are you taking daily or once in a year? That make huge difference. Correct. That will affect the physical, physiological, and psychological function of the body, and it becomes drug abuse. Correct. Smoking is one method, and smoking, most of people start with the smoking and then they move to the hard drug. Right? Tobacco is used by the human being for many years, 400 years. Tobacco can be smoked, tobacco can be chewed, tobacco can be sniffing like this. Correct. So tobacco contain very harmful chemical. One of the chemical is nicotine. Nicotine is alkaloid base. Nicotine stimulate the adrenal gland, and when it stimulates adrenal gland, adrenaline and noradrenaline is released in the blood. Correct. Both increase BP as well as heart rate. We know from the hormone chapter. Correct. Smoking. If person is smoking, there is high chance that there can be lung cancer. There can be urinary bladder cancer because it will stuck in the from kidney. It will stuck in the urinary bladder or in the throat. Correct. Person can have bronchitis because in bronchi it can settle. Person can have emphysema disease, because of the smoking. Coronary heart disease, blood vessel of the heart will blocked, or gastric ulcer person can have. So many problems. That's the reason why, like, I don't understand people why people smoke. When they say, ki, oh, it feel good, but there are many things to feel good. How you are harming yourself and you feel ki you are feeling good. Practically, it don't make sense for me. That's why I never smoked in my life. Reason practically which do not make sense for me, I can't do that. Correct. So, and the worst part is doctors and teachers are smoking, which make no sense. They are teaching other people to do this, and they themselves are consuming a lot, especially doctors. That's why what I want to convey you nowadays, because of social media, there are people who are going to gym, having a healthy lifestyle, and then they are showing the world. The doctor is not always about having big specs, very thick person, not doing any activity. This is the good use of the social media where doctors are showing they are going to gym, they are doing exercise, they are maintaining proper routine, and that's why they are doctor. And actually, they deserve to be doctor. Doctor is not having key reading for the whole time. No, doctor is understanding. I am reading this subject, so I can prevent disease first in myself. I should not have disease first because I know about this. Then I can prevent my family, my society. If you work in this way, you are the best doctor. If you see, ki, हाँ, I want to earn money, मुझे बहुत पैसा कमाना है, then this profession is not for you, because there are many other professions from where you can get a lot of money. But if you are working ki I want to treat patient and I want to make sure people are not getting disease in the first place, then this is the best profession, and you will start working from the very first year, because you know ultimately you have to prevent disease in people. Makes sense. Tobacco chewing tobacco is associated with the high risk of the oral cavity cancer. Tobacco smoking increase carbon monoxide. Carbon monoxide easily bound with the hemoglobin, and oxygen shortage will be there. Correct. And I want to read this, though it is not logical, but it is not much relevant to the exam. But I think what I always mention, it's not about whether you will be able to crack this exam or not. What you are learning from the process. If you never smoke in your life, it means you learned something from your biology textbook. If you know how to prevent disease in your life, you learn something from the book. And if you do any of this and still not taking care of the health, it means even if you become doctor, it is utter waste. So anybody buy cigarette packet, there is a warning ki you might get cancer, but still people ignore it. I don't know why. Correct. So, and not only young, even old people do the same thing. They know ki smoking is dangerous. It is addictive in nature, but still people are doing
So
it
no one
anyway.
should become like Mukesh. So seriously.
Yeah, correct. So nobody want to become like Mukesh, but still people are doing this. And it's not like only illiterate people. Every class of the society is doing this. Every single class. Even rich people are smoking. Rich people are consuming a lot of alcohol. Like there are many bad habits. So make sure become a better human being, better a healthy person, a mature person who can handle every situation. Then you are a good person. Doesn't matter how much you are, because you have to live with yourself. Example, a person who have kidney failure. Okay, now you will give cyclosporin A, immunosuppressive drug, right? You will try to avoid graft rejection, T lymphocyte, and all stuff. And then for whole life you are taking medication. What is the use of this medical science? First place should be how not to have such this, all these things. See, sometime you can have, sometime it is inevitable. Ki you are doing everything, still people get disease. They don't have. Correct. Sometimes people who don't smoke they get cancer, and people who are smoking they don't get cancer. Sometimes it happens, and that is their logic. कि सर जो स्मोकिंग कर रहे हैं उनको इतना कैंसर नहीं होता जितना नॉन स्मोकिंग वालों को होता है, तो क्या ही फायदा, फिर स्मोकिंग ही कर लेते हैं। अरे ऐसे तो जहर खाने के लिए भी वो भी खा लो, है ना, वो भी तो खाने के लिए ही बना है ना, क्या ही दिक्कत है, मना तो है ही है। So, and this adolescent means both a period and process in which child become mature, attitude change, belief system change, and how he will develop in the society will become. What is the adolescent period? This, correct? The 12 to 18 is adolescent period. This number is really, really important. Okay. Adolescent is something that link our childhood to adulthood. So this period decide what kind of person you become. That's why everybody is looking like how you will crack NEET at the age of 18. But I think if you develop the mindset at the age of 12 or 13 or 14, that will make you a better person, be more ready for the NEET exam. So next time, if anybody want to become doctor, they should like have the clarity at the age of 12, 13 at least. Because by then they can read more science, experimental science, enjoy the process rather than reading every day. I'm not saying ki every day read for 10 hours and become doctor. No. Temperament. reading science in the curious way, solving math so you are really, really fast. Example, you are in the drop year or you are in 12th class, your math is weak. What you can do, tell me. And how is that possible to crack NEET exam if you are in 12th and your math is weak? But if your math is weak in class 6, at least there is enough time to improve.
तो नीट में
Makes
मैथ
sense?
तो नहीं आती,
क्या?
मैथ्स तो आती नहीं नीट में।
फिजिक्स तो आती है ना, फिजिक्स केमिस्ट्री, वहां पे तो कैलकुलेशन फास्ट चाहिए ना, बहुत ज्यादा फास्ट चाहिए ना कि एकदम ऐसे ऐसे करके चीजें हो जाए. You know, many people whose math is very poor, they enter into the medical field कि हाँ मैथ नहीं है इसलिए मेडिकल ले रहे हैं. And I think this is one of the worst decision, because if your math is weak you cannot crack this exam. Why? Chemistry, speed calculation. Math is not just about the calculation part. Math is also give you the temperament of thought, thinking. You are creative. You understand the logic. Biology give you कि you can mug up, which is the worst thing to do. Just mug up, and mug up. If your biology is good and math is bad, I feel कि there is lack of you know logical thinking in the perceiving the object. कि हम समझ नहीं रहे हैं उस सब्जेक्ट को, बस हम रीड कर रहे हैं. वी आर जस्ट रीडिंग कि वी कैन रिमेंबर मोर फैक्ट. बट सब्जेक्ट इज नेवर अबाउट द mugging up and remembering more. Am I right, Chandana? Because she have math. That's why I always poke her ki Chandana, math.
Yes, sir.
Chandana, what is your opinion? Because you manage balance between both about math and biology. Is math more logical or math is more calculative?
So more logic.
Exactly. See, guys, math is more logical. And I won't say my math is great, but it's not bad. That's why maybe sometime you feel ki sir, uh, you have to remember the formula of sine theta 2 sine theta cos theta is equal to what, this is equal to what. You can have sheet, you can use that, but you want to see ki what are the possibility when you use Punnett square, when you solve question of principle of inheritance, hemophilia, and all. You look for the possibilities. There was one more topic based on the possibility, like this possible answer, this possible answer. In case of evolution, Hardy-Weinberg principle, you look for the possibility. Math is telling you these are the possible thing, right? सारे बोर हो रहे हैं कि सर क्या पढ़ा रहे हो, पढ़ा लो ना जल्दी से. Jordan is like that. पढ़ा दो ना सर, नीट का एग्जाम है 24 days के बाद में देख लेंगे हम मैथ होगा कि नहीं. Come to the point. So, in case of adolescence, we know there is biological change, there is behavior change. This is one of the most vulnerable phase for the mental and psychological development. Correct? Curiosity is one of the main reasons. We want to be more adventurous, we want to be more excited, we want to do experiment, and that is the main cause from where this process starts of the drug and alcohol abuse. Because child have natural curiosity to do experiment. Correct? And this is further complicated by many benefit की first use of the usually out of the curiosity कि एक बार करके देख लेते हैं क्या ही होगा. If you try once or twice क्या ही हो जाएगा. And tell me, is this right or wrong? First time when people consume drug or alcohol or smoking, they are usually forced by their friends कि कर लेना एक बार क्या ही हो जाएगा, एक बार में कुछ नहीं होता. Nothing happened in one time, so let's try, just be curious. और एक बार अगर हमने कर लिया तो दे विल से कि अरे किया तो था पहले, क्यों नखरे दिखा रहे हो. You already did like once or twice, so why you are just hesitating? And once you keep doing on the regular basis, then it become habit. You can't like leave it. Am I right? This is how thing happen in the society among the
Yes,
friends.
yes.
So, but later on, there is escape issue, there is stress, pressure, and like we have comparison in the society, in the academics, in examination. Then they try to do more to avoid the stress. E- Or the reality is you can't avoid stress by consuming alcohol or smoking, but people believe ki maybe some people think it is cool or progressive to smoke, especially in the youth. I don't understand why. Sometimes TV, movies, newspaper, or internet show us ki okay, this movie, it was cool, actor was doing smoking and all, and I don't know why people smoke and they show ki okay, they need to smoke to show that if this is a real problem. Correct. Next, I think this is the last topic now. Ah, eh? There's a lot more. Now we can make it fast. So, addiction and dependence. There, if we are doing continuously, so addiction will become a psychological attachment to the effect of euphoria and temporary feeling of the well-being. Correct. If we keep on doing, then doses will increase. It will come into the regular picture. Correct. If we try to leave the alcohol or smoking, there are unpleasant and withdrawal symptoms. Correct. Body have tendency to consume alcohol continuously. If you suddenly stop it, then there is some negative impact, negative symptom like anxiety, shakiness, nausea, sweating. Correct. And if you start consuming again, it become normal. These are the withdrawal symptoms. Sometimes it is life threatening. Person need medical supervision. I have seen recently one of my neighbor. I told you, he consumed a lot of alcohol, lot of from the morning to evening, lot of alcohol. Suddenly, last month, like he quitted the alcoholism, and suddenly he got so stressed. There were so many symptoms, anxiety attack. So he was admitted to hospital for 5 days, and people were like, "What will happen now? Everything is normal." He quitted recently. So it happened. It happened in every situation. Correct. Every good thing is painful in the beginning. Correct. So dependence lead to the patient to ignore all the social norm to get sufficient fund to satisfy her need, and may lead to the many other problems. Correct.
So
So
I'll have to leave now. So
okay, sure. So
I sent you a message on WhatsApp also.
okay, people who take drug intravenously by needle and syringe, they have more chance to get AIDS or hepatitis B. This is important. Correct. And it can spread from one person to another person. It can lead to chronic infection in case of AIDS and hepatitis B, and sometimes most of time fatal in the end. Correct. Both are transmitted with the help of sexual contact and blood. Remember, not only AIDS, hepatitis B is equally important because it can transfer through sexual contact as well as infected blood. Correct. If we use alcohol during adolescence, it may have long-term effect and lead to the heavy drinking in the adulthood. And long-term use of the drug and alcohol damage the nervous system and liver. This is known as cirrhosis. Very, very, very important. Two parties affect liver and nervous system. Second, it can happen because of drug and alcohol both. Correct. It can affect pregnancy also. During pregnancy, there can be adverse effect. Correct. Sometimes sports people abuse drug to increase their performance. They misuse the analgesic. They misuse anabolic steroid. They use diuretic. And this question can be asked: what are the misused drugs? They will give option like this: analgesic. Analgesic means painkiller. They reduce pain. Anabolic steroid to increase the mass, increase weight. Diuretic, more urine will pass. They use certain hormone in the sports to increase muscle strength and to increase bulk, to gain weight, to increase aggressiveness because they are more aggressive, more energy, more performance. Correct? To increase their athletic performance. Side effect of this in female is extremely important. Example, in case of female, anabolic steroid harmful effect is masculinization, male-like feature, more aggressive, mood swing, depression, abnormal menstrual cycle, more hair on the body, correct? Clitoris enlarged, voice deepen. In case of male, again, same problem. Male can have acne, female can also have acne. Aggressiveness is same, mood swing is same, depression is same, testicle size will reduce, sperm production will reduce, kidney can be damaged in both, liver damage can in both, breast enlargement in case of male, premature baldness you have seen in many people in recent times, correct? Premature baldness and a prostate gland will enlarge. Prostate cancer in, chances are more. Breast enlargement and this reproductive thing is really, really, really important. And baldness, premature, correct? And all these effect can be permanent. In adolescent male, female, severe body acne, face acne is common. Premature growth center and long bone may result into the stunted growth. Growth will change. Why? Because growth could happen for the long time, but it is not happening. Why? Growth plate will close. Growth center will close. Right. So this topic is really important for your need perspective. Anything I left, all other are like n- I think nothing much important from this part. In this key excessive dose of the drug can lead to the heart failure, respiratory failure, and cerebral hemorrhage, brain hemorrhage. Correct. That's why overdose is dangerous. Correct. So most common sign is their performance will decrease. They are missing college or school randomly, lack of interest in the personal hygiene. They remain alone, depression, fatigue, aggressive, rebellious behavior, not good relationship with the family and friends, loss of interest in the hobbies, change in the sleep, change in the eating habit, fluctuation in the weight and appetite. And tell me, out of these, what I just read here in the green color, how how many habit most of you guys have? Isolation, depression, living alone, eating habit, weight is not normal. How many of you have these things?
सर कुछ बोलेंगे तो विवाद हो जाएगा सर, क्यों बोलना कुछ?
Exactly. That's what I want to say. Ki now you are feeling like you are preparing for NEET, but still some of some or other symptom you have like drug abuse or alcohol abuse, education abuse, study abuse. Correct. So you can hopefully correlate with this. Ki अरे ये तो हमारे ही सिम्टम है आधे तो. um, many people think कि इस पैराग्राफ को पढ़ने का क्या ही यूज है. What is the purpose of this paragraph? We took so much time because I used to leave these paragraphs because this is more motivational and informational. But in recent time, I have seen question from this topic because we ignore it or we feel कि this is easy, we can solve it. But actually, when there are real questions, Pratigya, you must have seen last year. कि जब टेस्ट तुमने दिए होंगे और इस चैप्टर से क्वेश्चन आए होंगे तो मिस्टेक होती थी, राइट? इस पार्ट से भी, लास्ट वाले पार्ट से. Because everybody is reading disease, everybody is reading immunity, everybody is reading the drug, cocaine, um, uh, cannabis, and morphine. They are reading, but they are leaving last part and they make mistake. Am I right, Pratigya? Because when I was solving question, I was also making mistake, to be honest. Why? एवरीबडी फील किया रही ये तो इजी है, ये तो हम कर ही सकते। ओके, नेक्स्ट, दिस इज डन।
सर आप क्या बोल रहे थे? मेरा नेटवर्क उसका मुझे नहीं सुनाई दिया।
मैं ये कह रहा था कि लास्ट ईयर जब तुमने टेस्ट दिए थे एसवीएम में, तो बहुत सारे ऐसे क्वेश्चन थे ना जो इसमें से रॉन्ग होते थे, ये लास्ट वाले टॉपिक से, और हमें लगता था कि ये तो
हाँ
इजी है,
मैं
ये कर ही
पढ़ती
लेंगे।
नहीं थी,
क्या?
बहुत बोरिंग लगता था ये पढ़ने में, पढ़ती ही नहीं थी।
हाँ, ये लोग पढ़ते नहीं है, ये बोरिंग लगता है, एंड देन व्हेन वी गेट क्वेश्चन वी मेक मिस्टेक, और फिर लगता है ओ माय गॉड ये इतना इजी, ये कैसे गलत हो सकता है, राइट? गिव मी जस्ट 1 मिनट। ओके, so first thing, most of these bad habit is taken during the adolescence. So to best identify the situation, correct? Identify the situation, take remedial measure on time. Parents and teachers have special responsibility. Tell me, guys, are teacher taking enough responsibility for your behavior, or they don't care what you do? No, it is a big no from Aditya कि no sir, फर्क भी नहीं पड़ता उनको कि हम जी रहे हैं कि नहीं, हम हैं भी कि क्लास में नहीं, राइट? दे डोंट इवन केयर कि आर यू देयर और नॉट, बट एक्चुअली
मतलब आप अगर देखोगे 12th के जो लास्ट में जो एंट्रेंस के क्लासेस हुए थे,
हाँ,
इट वाज लाइक कि टीचर आके पढ़ा रहा था और पीछे बच्चे अपना काम कर रहे थे। मतलब पीछे बच्चे कुछ खाना खा रहे थे, मेहंदी लगा रहे थे, क्या कुछ नहीं कर रहे थे। वो टीचर को कुछ फर्क ही नहीं पड़ रहा, वो आकर देख कर भी जा रहे थे, फिर भी कुछ फर्क नहीं पड़ रहा था उनको।
and to be honest, in coaching institute, in big coaching institute, this is the common phenomena. I'll ask you, Aditya, you were there in one coaching institute. Were they bother कि you even exist?
नहीं सर, शुरू शुरू में तो होता है कि हाँ भाई आ क्यों नहीं रहे, फिर उसके बाद तो फिर बंद हो जाता है। उसके बाद तो सिर्फ
They
जो
don't,
ज्यादा वो होते हैं ना, कि मतलब हाँ जो सिलेक्शन कर सकते हैं, अंडरवर्ड सेट है, उन पे ज्यादा ध्यान देते हैं।
but they never give regular report to parents कि अच्छा हाँ बताते हैं पेरेंट्स को कि ये हो रहा है, परफॉर्मेंस में ये आ रहा है, आप क्या क्या कर रहे हैं, इससे बात होती है ऐसी कुछ?
नहीं सर।
निर्जला कुमारी,
Yes, sir.
like you were there in coaching institute for 2 years. Were they bother about कि निर्जला आ रही है, निर्जला ने कितना काम किया, निर्जला की मेंटल हेल्थ ठीक है कि नहीं, पढ़ाई हो रही है कि नहीं, रेगुलर आप
नहीं,
कितना चेक कर रहे हो?
कुछ भी नहीं। और सर इसके लिए, ये चेक करने के लिए रेगुलर के लिए अलग से बैच भी लिया था 12th में, एक्स्ट्रा पे किया था। और उसमें ज्यादा बच्चे नहीं थे, 8 बच्चे थे, और उसमें भी उन लोगों ने वही बकैतियां करी है कि मैं बता नहीं सकती, कि मुझे वो मेरा एक्स्ट्रा पेमेंट वापस चाहिए।
एग्जैक्टली। प्रतिज्ञा, यू वर देयर इन कोचिंग इंस्टीट्यूट, तो क्या कोचिंग इंस्टीट्यूट को ये पता था कि प्रतिज्ञा डेली कितना काम कर रही है, वो स्टडी प्रॉपर कर रही है कि नहीं? नहीं आ रही तो क्यों नहीं आ रही, पेरेंट्स ने क्या क्या स्टेप लिए कि वो बेटर करे, और जब कम आ रहे थे तो उसको इम्प्रूव करने के लिए क्या क्या स्टेप लिए कोचिंग ने?
सर उनको तो कुछ फर्क ही नहीं था। अगर एक बार पापा ने प्रिंसिपल सर से बात की थी, वो इतना मोटा मोटा बुक दे दिए थे पढ़ने के लिए, और पापा खरीद के भी लाए थे।
बाय द वे गाइस,
वो
प्रतिज्ञा
ट्रू
फादर
मैन वाला
गॉट
बायो बुक।
ट्रू मैन, Pratigya father
यस
got True Man. True Man is such a big book, too big book. It's like 8 to 10 time of NCRT content. 8 to 10 time of
इस
NCRT
बार
content.
और फिजिक्स केमिस्ट्री भी कुछ कुछ मोटे बुक्स लेके आए थे, नाम तो याद नहीं है मेरा, प्रिंसिपल सर
And
बोले
she,
थे इसीलिए।
और all those book were not useful at all. कोई काम की नहीं है, ना पढ़ी होगी तुमने, है ना?
हमने तो टच ही नहीं की थी उसे।
See,
एक ही बार हाँ लाए हैं पापा, तो एक तक खोल के दिखी थी, वरना दोबारा कुछ की ही नहीं थी।
that's why when I talk about the coaching institute, na, my only purpose is कि student and parents should be aware कि what is their purpose to going to coaching institute. Is their purpose getting fulfilled? Because coaching institute, any coaching institute don't care what you are doing. They are not even bother 1% what you are doing. Am I right? Whoever went to coaching,
सर
raise
वो
your
सर
hand.
उन पे ही ध्यान देते हैं जो मतलब आगे के टॉप के अंदर 40 बच्चे हैं तो उसमें से 5 बच्चों पे ध्यान देंगे जो बढ़िया नंबर ला सकते हैं बस।
बट पे तो सारे कर रहे हैं ना।
हाँ
एक्चुअली
वही।
जो टॉपर बच्चे होते हैं ना, वो उनकी फीस भी मोस्टली रिलैक्स होती है, ऑलमोस्ट 100% फीस माफ होती है। वो तो एक्चुअली एक्चुअली उनको जो पैसे दे रहे हैं वो बच्चे जिनका सिलेक्शन नहीं होगा।
सर
कोचिंग
हमारी
इंस्टीट्यूट,
कोचिंग में बी एएमयू में AIR 1 आई थी उसकी 11th में। वो बिल्कुल फ्री में आकाश में 11 12 किया और उसी पर पूरा फोकस रहता है कि हाँ ये करेगी, अरे वो तो दे देगी भाई, रैंक बिल्कुल देगी।
हमें समझाओ ना, जहाँ पे
वही,
डाउट बार बार आ रहे हैं।
उसने तो 11th में भी AIR 1 ले आई और अब तो वो कर ही लेगी। हम लोगों पर फोकस करो ना, आप उस पे ही क्यों कर रहे हो।
और
उसके
हमने
तो
पैसे किस
फादर
बात
भी
के
सर
दिए हैं?
फिजिक्स फैकल्टी आकाश में, उसके फादर
हाँ,
भी। अब सोचिए उसकी फिजिक्स कितनी अच्छी है। वो
हाँ।
घर पर अपने फादर से पढ़ती है और यहाँ कोचिंग में मतलब अलग ही।
बट मेक द मेन पॉइंट इज कि हमने फीस किस बात की दी है
तो
कि
मुझे लगा
टॉपर
था
को
मैं तो होटल में रहना आई हूँ, रेंट में रहने वाली ऐसे लग रहा था।
ओके, तो लास्ट पॉइंट देन विल डिस्कस क्वेश्चन कि parent have lot of responsibility, teacher have responsibility to take care ki what child is doing, informing the parents about the child behavior, correct, and lower the risk. What we can do, avoid undue peer pressure from the children, giving too much responsibility कि नीट करना ही पड़ेगा वरना तो दुनिया बदल जाएगी। ठीक है, जितना लिमिट है वो कर रहे हैं, लिमिट को पुश भी कर रहे हैं, बट नॉट टू मच, करेक्ट। Proper counseling is important to avoid the stress. Seek help from the parents and peer, talk to them, look for the dangerous sign and seeking the proper professional medical help. That's all. And this, always read summary. Always read summary. Just one quick reading. So you will get idea if there is any important point you missed. You will always get only 1 point from the full summary, hardly 1 point, nothing else. Example, in case of normal NCRT, cholera disease is not mentioned. So you don't know whether it is caused by bacteria or not. But here it is mentioned: typhoid, cholera, pneumonia, fungal infection of skin like ringworm, malaria, and many more diseases. So cholera is mentioned. Cholera is bacterial disease. Important to learn. Correct. So these things make difference if you get one extra point. Correct. Example: this antimicrobial substance are present in our tear. This is not given in normal NCRT. Correct. This is not given in the normal NCRT. The antimicrobial substance are present in tear. Though it is written that tear is come under physiological barrier. Correct. Like it is explicitly written, antibodies give this response and cell mediated. It is properly written here, but not in normal NCRT.
सर
That's all. Yes, chapter done.
Sorry, I had to leave. What did you guys do in the last half an hour?
Last half an hour we finished the full chapter.
Did you do questions also?
We are doing question now. Yes.
Okay.
But can you explain again the cancer in short?
कैंसर का कौन सा पार्ट?
Sir,
कैंसर का कौन सा?
are the carcinogens cause cancer or वाला part about metagenesis also?
देखो,
Cause
मेटाजेनेसिस का
cancer
मतलब
वाला.
होता है सबसे डेंजरस फॉर्म मैलिग्नेंट ट्यूमर की, जो आसानी से स्प्रेड हो सकता है एक प्लेस से दूसरे प्लेस में, और जो सबसे ज्यादा हार्म करता है वही मेटास्टेसिस है, मैलिग्नेंट ट्यूमर की सबसे डेंजरस फॉर्म। दूसरा, जब हमने बोला था कि ऑन्कोजीन, तो ऑन्कोजीन वायरस वो वायरस होते हैं जो नॉर्मल सेल को वायरल कैंसरस सेल में कन्वर्ट कर देते हैं, जैसे रेट्रोवायरस करता है। रेट्रोवायरस कैन डू दिस। और पूछो प्रतिज्ञा। प्रतिज्ञा,
फिर से बताएंगे ऑक्सीजन के बारे में.
दोबारा बताना।
ऑन्कोजेन ऑक्सीजन के बारे में फिर से बताएंगे.
ऑन्कोजीन, तो ऑन्कोजीन नॉर्मल जीन है, नॉर्मल सेल में प्रेजेंट है। उन जीन की वजह से कैंसर नहीं हो रहा है नॉर्मल सिचुएशन में। बट अगर मान लो हमने स्मोकिंग की, तो लंग के अंदर हमारे पास ऑन्कोजीन थे जो कैंसर नहीं कर रहे थे, बट इनएक्टिव थे। जैसे ही स्मोक लंग के अंदर गया लॉन्ग टर्म तक, तो वो जो प्रोटो ऑन्कोजीन थे जो अभी तक एक्टिव नहीं थे, वो एक्टिव हो जाएंगे और उसकी वजह से कैंसर हो जाएगा। तो स्मोकिंग एक्टिवेट कर देता है वो ऑन्कोजीन, जो इनएक्टिव थे उनको एक्टिव बना देता है। और पूछो प्रतिज्ञा।
हो गया.
We have scientist name also in this chapter because this is the first chapter of the unit, है ना? तो स्वामीनाथन, he is considered the father of green revolution in India. Father of green revolution in India. जो साइटोजेनेटिक और रेडिएशन रिसर्च होती है वो इस्टेब्लिश हुई थी आईएआर में, और आईएआर इंडियन एग्रीकल्चर रिसर्च इंस्टीट्यूट न्यू दिल्ली, तो उनमें इनका बहुत बड़ा रोल था। उन्होंने राइस की शॉर्ट ड्यूरेशन हाई यील्डिंग वैरायटी डेवलप की थी, राइस वैरायटी डेवलप की थी शॉर्ट ड्यूरेशन के लिए, है ना? और उसमें बासमती भी थी। उन्होंने बहुत सारे कॉन्सेप्ट लाए थे, जैसे क्रॉप कैफेटेरिया, क्रॉप के बारे में अवेयरनेस के लिए, क्रॉप की कैसे शेड्यूलिंग होनी चाहिए, जेनेटिक इंप्रूवमेंट कैसे होता है, कि ईल्ड कैसे बढ़ा सकते हैं, क्वालिटी कैसे इंक्रीज कर सकते हैं। करेक्ट। स्वामीनाथन वाज वर्किंग विद वेरी फेमस साइंटिस्ट हु गॉट नोबेल प्राइज, नॉर्मन बोरलॉग, ना? And they were working on the green revolution because they were working on the Mexican variety of the wheat in India, ki how we can introduce wheat in India, Mexican variety. Correct. He also recognized and worked the lab to land, ki whatever we are working in lab, it should go to the ground level so farmer can use it and farmer can use it product. तो बस एक समझ लो बात सिंपल भाषा में, कि जो भी आज हम whatever we are able to eat today, we have sufficient food in India, we don't have shortage of food in India. One of the prominent person responsible for this is Swaminathan. आज अगर हम खाना खा रहे हैं ना शांति से और काम कर रहे हैं, वन ऑफ द बिगेस्ट रीजन इज दिस पर्सन स्वामीनाथन। क्योंकि 1960s के टाइम में, 1965 के टाइम पे इतनी शॉर्टेज थी फूड की, इतनी ज्यादा शॉर्टेज थी कि हमारे पास पैसे भी नहीं थे वीट खरीदने। और जो अम, जो वीट हम नॉर्मली सुअरों को देते हैं, एनिमल्स को देते हैं, है ना, पिग्स को देते हैं, वो वाली वीट यूएस ट्रांसपोर्ट कर रहा था इंडिया को बहुत ही हाई प्राइस के ऊपर। तो वी कुड नॉट सर्वाइव, एंड एट दैट टाइम लाल बहादुर शास्त्री, द प्राइम मिनिस्टर ऑफ इंडिया एट दैट टाइम, तो उन्होंने ये कॉन्सेप्ट लाया था कि एक दिन भूखे रहो, है ना, तभी जाके हम थोड़ा सा सेव कर सकते हैं अनाज को। इतनी शॉर्टेज थी। और उस टाइम पे ये इंसान ग्रीन रेवोल्यूशन लाया, हाई यील्डिंग वैरायटी लेके आया, और मतलब 2000 तक ऐसा हो गया था कि कोई इंसान भूख से तो नहीं मरेगा। अब हमारे पास ओवर है, हम एक्सपोर्ट करते हैं, और उस टाइम पे सब कुछ खाना हम मोस्टली इंपोर्ट करते थे। और ये देखो, इतना महान इंसान को कितने लोग जानते हैं, अब तुम खुद बता दो। यही है लैक ऑफ एजुकेशन, कि जो मेन इंसान पॉपुलर होना चाहिए, जिसकी वजह से आज हम सरवाइव कर पा रहे हैं, उसी की रेपुटेशन नहीं। ओके, तो फूड सिक्योरिटी पे ही वाज वर्किंग, कि कैसे एनवायरमेंटल प्रोग्राम इंट्रोड्यूस। तो उनको पद्म भूषण भी मिला था उनके वर्क के लिए। और जैसे मैं बोल रहा हूँ, ग्रीन रेवोल्यूशन, फूड की शॉर्टेज थी, उसको बेटर करना था, उसके लिए यही रिस्पॉन्सिबल। बायोलॉजी एक यंगेस्ट ब्रांच है नेचुरल साइंस की, क्योंकि अगर हम देखते हैं कि प्रोग्रेस फिजिक्स और केमिस्ट्री में तो बहुत फास्ट हुई थी, फास्ट डेवलपमेंट हुई थी, बायोलॉजी की जो एप्लीकेशन है ना, डेली लाइफ में डायरेक्ट दिखती नहीं है, इनडायरेक्टली तो दिखती है कि डिजीज को हमें कंट्रोल करना है, बट डायरेक्ट एप्लीकेशन हमें कम दिखता है बायोलॉजी का। तो उसकी वजह से आज हम डायग्नोसिस कर रहे हैं, फूड प्रोडक्शन बढ़ा रहे हैं, उन सब में बायोलॉजी का ही इम्पोर्टेंट रोल था। कोई डाउट? So this full chapter is done. Take 5 minute break, and then we'll do 30 questions of this chapter, and chapter will be. So first question, Aditya, emphysema, angina pectoris,
बी का 3,
acute chest pain, not enough
डी का
oxygen,
4
glomerular,
और डी का
4, technical rapid spasm in the muscle due to low calcium in the body fluid. Correct. A2, B3, C4, A2, B3, C4, D1. Correct. Anvita, not correct.
सर एक बार पढ़ने देना 2 मिनट। एंटीजन बाइंडिंग साइट इज लोकेटेड एट सी टर्म, नहीं एन टर्मिनल ना सर।
Constant region of heavy and thin are located at C terminal of antibody. Yes, constant region are present on C side. Too light, too heavy chain
सही है, लास्ट वाला
held
भी
by
सही।
disulfide bond. Chandana,
Yes, sir.
non-specific at the time of birth.
Sir, innate immunity.
Innate immunity. 3 question from, not 3, 4 question from this. After maturation, Barinder, primary lymphoid organ lymphocyte migrate to the interaction of the antigen to secondary site, like C, D, E. Why? These 3 are secondary organ, lymphoid organ. Thymus and spleen are primary lymphoid organ. Oh my god, 5 question from this chapter. CT scan, CT scan and MRI detect cancer of the internal organ.
सर बताना
Chemotherapeutic
क्या
drug
इसमें
used.
करेक्ट है कि इनकरेक्ट? सर पहली
Chemotherapeutic drug.
स्टेटमेंट ठीक है।
Second,
सर रोंग है। यस सर, थर्ड भी ठीक है।
तो ऑप्शन देख लेते हैं, इनमें से करेक्ट पूछा है ए, सी।
सर वो केमोथेरेपेटिक ड्रग्स और बायोलॉजिकल रिस्पॉन्स मॉडिफायर्स
No, 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 no. Chemotherapeutic drug are the medicine that destroy the cancer cell. They are not biological response modifier. Biological response modifier are alpha and interferon that improve the immune system. Correct.
यस सर गॉट।
Alpha interferon activate the immune system of cancer patient and destroy the tumor cell. Correct. That's why C. Alpha interferon are not chemotherapeutic drug because they are biological intensifier. Oh my god, I think 6th question. Neoplastic characteristic of this cell. Rayan.
यस सर डी रॉन्ग।
सर ये वाला एक्सप्लेन करिएगा, न्यूप्लास्टिक वाला।
न्यूप्लास्टिक प्रॉपर्टी होती है मैलिग्नेंट ट्यूमर में, जो थोड़ा सा डेंजरस होता है। उसकी सेल बहुत फास्ट डिवाइड करती हैं, तो रैपिड ग्रोथ होती है। प्रोलिफरेटिंग सेल है, प्रोलिफरेटिंग, जो डिवाइड करने की एबिलिटी रखती है। साइड वाले टिश्यू को डैमेज कर देती है, जो कन्फाइन होते हैं एक पर्टिकुलर लोकेशन पे, तो उसको हम बोलते हैं बेनाइन ट्यूमर। तो ये तो गलत है। और बची हुई 3 प्रॉपर्टी न्यूप्लास्टिक की है। अब मुझे ये बताओ कि 6 क्वेश्चन थे नीट 2026 में। हमने मान लो कि हमने मॉर्निंग से 3 आवर लगाए हैं इसमें, ठीक है। 3 आवर लगा के हमने 24 मार्क्स कवर कर लिए। 6 क्वेश्चन, 3 आवर में 6 क्वेश्चन। अगर 1 आवर में इसका मतलब 2 क्वेश्चन किए तो बहुत अच्छा। 250 घंटे बचे हुए हैं हमारे पास। 250 घंटों में अगर हम पढ़ने की कोशिश करें और 1 घंटे में 2 आवर करें तो मोर देन इनफ। कोई नीट 2025 लोग बोलते हैं बायोलॉजी बहुत टफ था। किसी को लगता है एनी ऑफ यू फील कि इवन सिंगल क्वेश्चन इन नीट 2025 वाज रियली डिफिकल्ट?
No,
Not even a single question. So make sure whatever you read with the perfection and take less time in the question because we read properly. Sarah, antibiotics are the chemical produced by the microbe that kill the other microbe, and antibodies
Yes.
are the chemical formed in the body that eliminate the microbes.
Yes, sir.
Correct. Next. क्या बोलते हैं निर्जला? malignant tumor,
मेटास्टेसिस,
malt,
लिम्फोइड
50% liver,
वो डिस्ट्रॉय
नाको,
ट्यूमर्स नहीं, और ये एड्स, अल्फा इंटरॉन्स डिस्ट्रॉय ट्यूमर्स।
then next. Nikki, B lymphocyte, interferon, क्या? colostrum passive immunity, anti lymphocyte cell mediated immunity. Autoimmune disorders, myasthenia gravis, yes. Rheumatoid arthritis, yes. Gout, no. This, no. Systemic lupus, which of the following is the appropriate in this case?
ABE, option B, sir.
ABE, yes. Systemic lupus erythematous. Erythematous means it is kind of allergy. Again, I will show you. This is the kind of allergy. How do I get to know? Just erythematous means kind of allergy. This is acne type issue. And a chronic multisystem autoimmune disorder where immune system attack healthy tissue, cause inflammation like skin, joint and kidney. And even what I want to tell you कि अगर नहीं भी पता, ये तो दोनों तो पता है, माइस्थेनिया ग्रेविस हमारे सिलेबस में है, रूमेटॉइड आर्थराइटिस सिलेबस में है, तो ए भी तो करेक्ट है ही, है ना। और हमें पता है मस्कुलर डिस्ट्रोफी एक जेनेटिक डिसऑर्डर है, तो ये नहीं हो सकती, और कोई ऑप्शन में बचा ही नहीं है, तो यू कैन एलिमिनेट। तो जो भी आउट ऑफ एनसीईआरटी क्वेश्चन फ्रेम होते हैं, मोस्ट ऑफ आउट ऑफ एनसीईआरटी क्वेश्चन आर एक्चुअली फ्रॉम एनसीईआरटी बिकॉज you can eliminate them. They never directly ask systemic lupus arthritis, like what is this disease? Is it autoimmune disease? Nobody asks. Okay, elimination method. Next. तुम मुझे याद करना कि कौन कौन है यहाँ पे। Chandana, did I ask you question? पता क्या, I didn't ask you question. Yes. Typhoid, filariasis, ringworm, Leishmania. Leishmania, this trypanosoma, both are protozoa. But again, you don't have Leishmania in your syllabus, you can
Sir,
eliminate.
filariasis is protozoan, right?
Filariasis, elephantiasis, Wucheria is nematode. Understood, Jan?
Yes, sir.
Next, Chandana, common cold.
It's a rhinovirus.
Hemojoin.
Plasmodium.
Vidal test. It should be this salmonella. By mistake they wrote salmonella. Okay.
Yes.
And allergy.
Dust.
Vidal test typhoid fever. Typhoid fever was given. Then did I miss any? Who else is there?
So this is the 7th question, no? From 2024.
Yeah, even 2024 there were so many questions.
बट दो थे ना, तो दो का होगा ना, एक री वाला और एक नॉर्मल.
हाँ. Then Aditya, bone marrow is the main lymphoid organ where all the blood cells.
2024 also 6 questions were there.
Yeah. Both bone marrow thymus provide microenvironment for development and maturation of T lymphocyte. Both are correct. Any doubt, Aditya? If you feel ki sir, I didn't understand, you can ask again, guys. Then Anvita, STD that are completely curable.
सर सी, नहीं सॉरी डी सर डी होगा ना.
जो भी वायरल डिजीज उनको हम completely क्योर नहीं कर सकते ना, तो सिफिलिस और ट्राइकोमोनियासिस वायरस से नहीं होते, तो इनको क्योर कर सकते हैं. क्या समझे, है ना? जैसे इसमें लिखा हुआ है HIV और ट्राइकोमोनियासिस. HIV वायरल इन्फेक्शन तो उसका क्योर नहीं है ना. ट्राइकोमोनियासिस पैरासाइट की वजह से होती है, उसको एंटीबायोटिक से क्योर कर सकते हैं. सिफिलिस और ट्राइकोमोनियासिस दोनों क्यूरेबल है, क्योंकि सिफिलिस बैक्टीरिया से होती है, पेनिसिलिन हम देके उसको ठीक कर सकते हैं. ट्राइकोमोनियासिस हमने बोला है एंटीबायोटिक से ठीक कर सकते हैं. हेपेटाइटिस बी और जेनिटल हर्पीस दोनों वायरल इन्फेक्शन है, दोनों के क्योर नहीं किया जा सकता. लास्ट, genital herpes and genital warts both are caused by virus, correct? While symptom can be managed, but they are not curable, so only option is B. Next, Pratigya, typhoid, elephantiasis, ringworm, malaria. Next, Chandana, cellular, physiological,
Yes.
physical,
Me press.
right? Next, Nirjala, ringworm,
Veris
bilharzius,
Vegeria,
malaria.
Malaria, Plasmodium vivax, pneumonia, Haemophilus influenza.
Next, Rayan, blood cell HIV undergo replication and produce progeny. T helper cell and macrophage. T helper cell and macrophage. Next, Sahil, heroin, marijuana,
सर फर्स्ट
cocaine.
का बी, सेकंड का ए, कोकेन का 4th और सर डी का 3.
Exactly. Next, these are the following reason for the graft rejection, cell-mediated response. Next, on है Nikki, cellular, cytokine, physical and physiological, right? Next, who is left? Am I leaving anyone? Barindra, are you there?
Yes, sir.
तो वीडियो ऑन करो, किसका वेट कर रही हो? आदित्य, प्रतिज्ञा.
तो फोन की बैटरी लो है तो चार्ज पे लगाया हुआ है.
ठीक है, बताओ फिर वरिंदर. Autoimmune disorder is a condition where body defense mechanisms recognize own cell as
Correct.
foreign body. Second,
Second, correct. The second
It
is false.
attacks self-cell. It attacks self-cell. And second is wrong. So first one is correct and second one is wrong. Correct. Next, Manan. Spleen is a graveyard of RBC. Correct. Coagulum is formed by the network of thread called fibrin. Correct. Fibrin network it will form. So second is correct. First is incorrect. Next, Aditya.
डी पार्ट। ठीक है सर, ऊपर की तीनों, नीचे वाली गलत है।
Yes, acquired is specific. Acquired is specific. Then Anvita, incorrect. Lectin is
The
concanavalin A,
first one
correct.
is correct. Second is also correct. Sir, C. I'm not sure between C and D.
Abrine and ricin are toxin. Drugs are vinblastine and curcumin. Vinblastine and curcumin. Curcumin and vinblastine are drugs. Concanavalin, this abrine and ricin are toxin. Morphine are alkaloid. This vinblastine and curcumin. Effective. Next, Pratigya. Early diagnosis. This is important. Which of the following very useful in the early detection? Aliza is correct. Sudden bloating is DNA fingerprinting, like DNA, if you identify both are correct. So, but in this chapter, ELISA is given. Okay. Recombinant DNA technology, PCR and ELISA are the technique for the early diagnosis given in the biotechnology application. Okay. Next, Chandana. Adenosine deaminase deficiency result into?
Option A. Sir.
Yes, gene therapy. We'll do next chapter that only. Next, Nikki. Filariasis, MBBS, pneumonia, and ringworm. Next, Ryan. Typhoid,
So typhoid,
pneumonia,
salmonella, malaria, plasmodium, filariasis, Wucheria, pneumonia. the rest.
and you must be feeling कि सर आप तो बहुत फास्ट जा रहे हो. इंटेंशनली जा रहा हूँ क्योंकि अगर हमें नीट करना है ना तो क्वेश्चन फास्ट करने की आदत होनी चाहिए. पहले 5-10 क्वेश्चन में you will realize कि सर you are going too fast. After that you will have habit to pick it up fast. Otherwise you will lose the question. है ना? तो I am trying to put timing. You have to make it fast. Next, Sarah. Infectious stage of plasmodium that enter into human body. Then Nirjala.
Yes, sir.
Round.
120 million dollar. बी ऑप्शन ही होगा.
बी ऑप्शन ही होगा क्योंकि एक्टिव इम्यूनिटी इज स्लो एंड टेक टाइम टू फॉर फुल रिस्पांस. यस प्रतिज्ञा.
क्लास कब एंड होगी?
क्लास कभी नहीं एंड होगी, अभी तो शुरू की है.
सर क्योंकि मेरे फोन में चार्ज ही नहीं है इसलिए पूछ रही हूँ.
साथ लगाओ साथ साथ में.
सर
साथ
चार्जर
साथ
बोर्ड
में
तो बहुत ऊपर है.
फिर बहुत ऊपर जाओ. अभी तो बस एक बार मुझे लंच करना है तो उसके लिए आधे घंटे का ब्रेक चाहिए वरना फिर क्लास कंटिन्यू होगी. ये बस 50 के आसपास क्वेश्चन करेंगे. करेक्ट पेयर ऑफ पॉजिटिव एजेंट ऑफ फीवर एंड टाइफाइड. विडाल टेस्ट, सैल्मोनेला, टाइफाइड.
Option C.
Next, after Nirjala, Manan. Human acquired immune response produce antibody neutralize the pathogen. Still innate is present in the birth because it is very.
सी.
Natural killer cell can phagocytose and destroy this. Sahil,
Yes, sir. Sir,
correct?
option C,
Hmm.
IgA.
Next, Brinder, graft rejection, cell mediated immunity. You should sometime, no, you don't need to read full question. You see the important word and instantly you mark. You will feel कि sir आप ऐसे fast क्यों कर रहे हो? Because you have to have habit to read the question quickly, especially when you don't have correct and incorrect. Correct and incorrect mean you can make mistake. I understand, but here you don't have that. Immune response and rejection were enough for cell mediated. Coca alkaloid
Okay.
cocaine is obtained from erythroxylum coca.
C.
Drug heroin is the synthetically from the acetylation of morphine. Which disease of mosquito transmit cause chronic inflammation of lymphatic elephantiasis? And keep giving answer. Part of the poppy plant from which obtains smag, latex. Transplantation with immune response rejection,
A.
same cell mediated. Malt 50%. Whenever you see one word, you should be like bacteria disease, cholera, tetanus,
Bacteria, typhoid,
AIDS.
cholera, and tetanus.
AIDS,
Correct regarding each cause of the
HIV have single strand RNA and reverse transcriptase enzyme. Correct. Antivenom perform here in this case you have pathogen, attenuated pathogen.
polio drops that are editing pathogens.
Not true for the cancer cell. Mutation inhibit the production of telomerase. Mutation ulta. Mutation in proton-cousin accelerates cell cycle. Mutation destroy telomerase inhibitor. So telomerase will activate, and telomerase is responsible for mutation. Telomerase is responsible for cancer. Remember this. Though it is old topic, remember mutation destroy the telomerase inhibitor. So telomerase should activate, and when telomerase enzyme act, it is responsible for cancer. As simple as that. Telomerase cancer. Telomerase cancer. So if you understand this, automatically first option is wrong because mutation is increasing telomerase. It is not inhibiting, right? So I know in this case you need understanding. That's why I explained it better than other. NCRT, self non-self property autoimmune disease.
D.
Major deficiency to which of the following you look confirmatory test major deficiency of antibody globulin because globulin have antibody. Immunoglobulin constitute largest percentage in human
IgE.
milk. Disease by the protozoa babesia. We already discussed this question, correct? Graft rejection. Done.
Kidney cell
Then, now tell me how much time we took to complete those questions. Hardly 10-15 minutes. 50 question. Reason because we did chapter properly. So you can take time to read theory to have better clarity, but always do question quickly. Remember why you should have it. You should have habit to solve question quickly. This is required for NEET. Not only knowledge, but also how quickly you do the question. So tell me, guys, how is this like speed solving question? Aditya,
Good.